In this video, I'm going to be talking to you about makeup tips if you are a contact lens wearer. Keep watching. Hello everyone, I am Dr. Rupa Wong, board certified ophthalmologist, and on this channel we talk about eye health, eye surgery, eye makeup health, and what to do to keep your vision safe. And so today we're combining a couple of those topics, eye makeup health and vision. So if you are a contact lens wearer and you love wearing makeup just as I do, I wanted to review a couple tips that you could do to keep your eyes super safe and healthy, especially if you are new to contact lenses or if you just wear them for cosmetic reason, like you like colored lenses, which is how I started. I never needed contacts to see clearly in the distance, so I actually was never really properly trained and educated before I became an ophthalmologist as to how to actually make sure I was taking good care of my eyes. So let's get started. But wait, before we do, if you wouldn't mind taking a moment just to subscribe, like, and comment, and let me know what kind of videos you want me producing so I can keep producing them for you. All right, now let's get started. First, I always recommend daily contact lenses. They are just always going to be the safest and healthiest for your eyes. They're going to allow the most oxygen to the front surface of the eye. They cause the least amount of problems, complications-wise. But if you can afford it, I know that daily contacts are more expensive than the 2-week or the monthly lenses. It's going to be helpful. And the reason I start off by talking about that first is because when you're wearing makeup, there's a lot of protein deposits that can get deposited onto your contact lenses. And that's what you're trying to avoid, because that proteinaceous buildup is what's going to make your contact lenses, number one, feel uncomfortable, and number two, even cause issues with the ability for you to wear contact lenses. It can result in things like giant papillary conjunctivitis, contact lens overwear syndrome. I'm not saying that all people that wear makeup are going to have those issues if they wear a 2-week or a monthly lens, but you can minimize them a lot by wearing a daily contact lens. So first, always wash your hands, of course, and put your contact lenses in before you put your makeup on. So this was new to me as someone that didn't need them to see clearly, and I was just applying them as part of my makeup routine. I loved green contact lenses, so I always thought that I should do my makeup first and put contacts in second. That's not correct. You want to put your contacts in first, because what it does is if you put your makeup on first, especially if you're doing any loose powder or shadows, there's a chance that your makeup debris and particulate matter can get trapped underneath the contact lens and therefore scratch the front surface of your eye, your cornea. If you put your contact lenses in first, then there's a barrier that's going to protect your eye, and the makeup and the protein deposits will go into the tear film and overlying the contact lens and not in the actual eye. Second, you always want to be really careful with moisturizers. This is something I also learned the hard way. So I knew that, fine, I need to put in my contact lenses before I do makeup, but I always do an antioxidant serum and a moisturizer. And once I did forget to wash my hands in between and then touched my contact lenses, which really burnt. So be really careful even of just your regular moisturizing lotion, because if you have it on the tips of your fingers and then you're touching your contact lenses, it can obviously go onto your eye and onto the contact lens and make it feel really uncomfortable. Might even be a particulate matter, which then rubs up against your eyelid as you're blinking. So wash your hands immediately prior to putting your contacts in. I also don't recommend tight lining, especially if you're a contact lens wearer. Tight lining is when you put eyeliner right at the mucocutaneous junction, also known as the waterline. And you have meibomian glands there, about 30 to 40 little meibomian glands on the top as well as the bottom. So both places. I know some people will top line the top as well. And if you're a contact lens wearer, you're already a little bit more prone to developing dry eyes. And when you block your meibomian glands, those are the glands that make the oil for your tear film, you're further exacerbating it. So I would not recommend tight lining, especially if you are a contact lens wearer. Another thing to avoid is glitter eyeshadow. I love glitter, but if you're wearing contact lenses, there's just so much dropout. Think about it. When you do glitter eyeshadows, that a lot of it just ends up in your tear film or in your eye itself. So I recommend just the cream eyeshadows, typically for use when you are a contact lens wearer, and just in general, it's just so easy. But I know you don't get the great blending effect like a powder. But if you're wearing contact lenses and you've had issues with your contacts, then go ahead and try doing a cream eyeshadow instead. Another recommendation I have is to avoid waterproof eye makeup. The reason for this is, again, it tends to be really occlusive, and the amount of traction that you need to remove that eye makeup is going to just not be so great for your eyelid skin or your lashes. And waterproof makeup in the either tight lining region or for mascara can impact the contact lens and just give you more buildup on the surface of the contact lens. When you are cleaning your makeup, you first always want to remove your contact lenses first and then take all your makeup off. Again, because you don't want any of the makeup remover or anything getting inside the eye. Try to avoid using oil-based makeup removers, especially if you are doing this backwards and leaving your contact lenses in your eye. And that's another reason. With waterproof eye makeup, you tend to need to use a oil-based makeup remover to get all of that stuff off. If you use regular non-waterproof, then you can use an oil-free makeup remover, and it's not going to impact the surface of your eye quite as much. And then last, remember to clean your makeup brushes. I know, everyone knows that they should do it, but you probably forget to do it. Think about how often you've cleaned your makeup brushes. It's just possibly introducing bacteria. When you are a contact lens wearer, you are already more at risk for infections because of the constant trauma of inserting and removing the contact lens. So you want to keep everything around the eye as clean as possible. So make sure to clean your makeup brushes. Make sure to throw out any old eye makeup past 3 months. Yes, even your mascaras, your shadows, you really should throw them away because they're not going to be as hygienic, and you can possibly introduce things that can give you an infection, and that's never something that we want to happen. Infections tend to be a lot more serious in contact lens wearers, again, because you are touching the surface of your eye so frequently. And again, this all goes back to why I prefer daily contact lenses. Once you remove your contact lens, make sure that you are doing the mechanical rubbing to clean it if you are in a 2-week or a monthly contact lens, because that's going to remove any of the particulate matter. Even throughout the course of the day, it's really common for makeup to migrate into your tear film and onto the surface of the eye, and therefore onto the contact lens. So when you remove your contact lenses at night, if you are not wearing a daily where you just throw it away in the trash, really make sure to use the solution and clean the contact lens on the palm of your hand. That's going to get rid of all of that particulate matter and just keep your eyes healthy and safe. All right, guys, that's it for today. So I hope you found these makeup tips helpful so you can continue doing the killer cat eye or whatever else you want to do with your contact lenses. Please like and subscribe, and let me know what kind of video content you want so I can keep producing it for you. Until next time, I'm Dr. Rupa, and I'll see you soon. Bye-bye.